It should be noted that when attaching the bite fork to the head frame, the rod assembly has two ends with one end shorter. The shorter end fits into the earbow frame. Doing so aligns the hex screw forward so that it will be easy to access with the Allen wrench. One will know if it's inserted correctly because the rod will not stick up above the level of the head frame. Seen in the video, it is correctly positioned and is flush with the frame. Newer models have the letter A stenciled in the end of the shorter rod and on the head frame where it is to be inserted. Another check is to make sure if the stop collar is firmly against the head frame on the inferior side. Completing the earbow procedure will require the help of the patient or an assistant. The patient in this case is asked to hold the head frame points in her ears while the clinician pulls forward with his index finger on the frame and simultaneously pushes the nasion with his thumb to tighten against the bridge of the nose. Once secure, he tightens the nasion adjusting screw and the head frame screw as seen here. One does not want this to be too tight, but it has to be firm enough that it doesn't flop around. Seen here, it is wiggly, but it is not moving drastically and therefore is acceptable. The next process is to place the bite fork in the mouth and attach the rod assembly to the bite fork and the head frame. Remember to position the assembly with the short end of the rod inserted in the head frame, with the screws facing down and out for ease of adjustment. If one loses the rubber cap from the rod as seen here, it is important to make sure the screw knuckle is positioned properly before securing. Seen in this footage, this earbow has an optional level. The purpose of this level is to align the incisal plane, or the aesthetic plane of the patient, with the horizon on the articulator. The operator must have the patient sit forward and sit erect with the head and eyes level on the horizon. If no assistant is available for the next step, the patient can help. While holding an erect posture, the patient was asked to glance at the level and twist the head frame so that it would be level while the clinician tightened the assembly. Again, the whole purpose of this step is to establish the aesthetic plane on the articulator. The horizontal member of the articulator then becomes the incisal plane for any aesthetic work that may be desired. It is important to align the rod assembly at 90 degrees. This helps minimize the chance of any interferences when articulating models on the articulator. Before removing the assembly from the patient, the operator must use the opposite hand to stabilize the rod assembly and bite fork while tightening very firmly. Once secure, simply loosen the head frame and screw, holding the bite fork assembly to the head frame, and remove from the patient. Panadent also provides optional plastic wing nuts instead of hex screws to perform an earbow.